My name is Connie Johnson. I am a native of Orangeburg, South Carolina. So I am a writer and I'm a singer. So those two things make me happy whenever I'm doing them. I call myself a community educator because I like sharing. Although I like learning, I like sharing what I learn. Honestly, the first time I actually went to go get a mammogram, I had to kind of really like amp myself up to go do it, you know, and so it kind of took the wind out of my sail when I realized that my insurance had been canceled and I wasn't going to be able to do it, and it was just a lot. And so now I feel like I have to go back and like build myself up again with the courage to go ahead and get it done. But I do know that getting a mammogram will give me, you know, the peace of mind that I need to be able to know that that part of me is healthy. You know, I am a health advocate for HIV/AIDS, and so, like I said, it's hard for me to be an advocate for one part of health without, you know, knowing the status of the rest of my health.
Well, cancer in general is normal cells that start to replicate rapidly, and as they accumulate, they form a mass or a lump, and then those cells can actually spread either through the lymph nodes or go to other parts of the body, which we would say is metastasizing. Early detection is important because breast cancer is the second most diagnosed cancer in women, with the exception of skin cancer. It occurs in approximately 1 in 8 women, and even less if you have a family history of breast cancer. And therefore, early detection affords you many possible treatments, and the earlier that you detect it, the greater possibility of cure. Self-examination, both in men and women, is recommended starting at the age of 18 to be once a month. It's basically a simple exam that you perform first. It's observation of your breasts. Before you take a shower, you observe your breasts in the mirror, seeing if there's any change or anything abnormal from one side to the other, possibly redness, possibly a bump, possibly a dimple, possibly a discharge. And then you lift your arms up and you observe your breasts in the mirror again, see if there's anything changed. And then most people prefer to do their breast exam in the shower because the water allows a slippery surface to feel your skin. So then in a circular manner, almost like clockwise, you go around each breast using the opposite hand. Right breast would be left hand, left breast would be right hand. And you're feeling for anything abnormal, a lump or anything tender, palpable. The American Cancer Society recommends starting at the age of 40, women should have a mammogram once a year. A mammogram can be performed in many settings, imaging centers. You just need a physician prescription, and that's all you really need to set up an appointment in any place.
The more you know, if you know, then you know how to move forward. So don't be afraid of the results. Don't be afraid of the procedure. Think of it as healthcare, and let's go get it done.